So over the years, one of the things you'll hear in therapy and also from phys ed teachers and coaches and doctors is that you shouldn't let your knees go past your toes in doing a squat or avoiding a deep knee bend. This is an idea that's been around for years. I still talk to patients about it today. They'll ask, is this safe to do? And this idea has been around for a very long time. So if you're doing your squat and you're getting to that bottom position, the idea is that your knees shouldn't go past your toes, okay? And you'll see a lot of people when they're squatting, they'll come down and they'll let their back and their hips go back and drive like this to avoid their knees going past, and they'll be coming up. And this idea started many, many years ago, 50s, early 60s, from a professor, Karl Klein at the University of Texas. And what he looked at, he was like the knee guru at the time. And he noticed among college football players especially, that the ones that really got hurt more often were ones that did deep knee bends as part of their strengthening program. He actually had an apparatus that he would test the laxity of the knees, and he noticed the ligaments were a little bit looser on the football players that got hurt, like they had a higher percentage of injuries. And then they started taking this out of their programs. New York City schools took it out of their phys ed programs. The military for a while took it out of their programs. And a lot of college programs, a lot of football programs stopped using that as part of their training because they noticed this connection they felt, at least, to knee health. What really drove this whole interest, you talk about, how did this get out to the general public? What happened was in 1962, Sports Illustrated highlighted Professor Klein's research and some of his recommendations. In fact, at the time, the American Medical Association also got on board and said you can cause severe damage to the medial, the inside part of your knee if you actually engage in deep knee bends. And their recommendations were to avoid them. And that's where these initial thoughts got started. And it's something that we still talk about today. But we realize as the research has gone on, we find that it's actually not really a movement that we should avoid for everyone. Obviously, we have to look at certain patients in front of us and athletes and say this may not be appropriate for these athletes. We do find is that actually it shows that it's a relatively safe movement. There is more pressure at the knee as we go into that deeper position, but it doesn't appear to be an increase in injury risk. And there's been some recent studies that have highlighted and that they've done reviews of the literature, and they found, yes, there is an increased pressure on the knee. Yes, there's something we have to watch for. But actually, those deeper movements actually ready certain athletes or people to engage in certain activities better. They actually improves performance. Obviously, there's certain rehab candidates or people that are coming off of an injury that we have to say, hey, this is not appropriate, this deep knee bend. But there's other things, and when we do avoid that deep position as you're looking here, as we drop down, as we avoid that deep knee position, we hinge more at the hip and the lower back. And they've shown people that avoid that deep knee position actually have a lot more stress on their lower back and hips. So sometimes, as much as we're sparing the knee in theory, we're actually causing more pressure to other areas. I like to think of it as that we're sharing, as we allow the body to naturally squat down, we actually have every joint and we allow the whole body to take the stress of the load. So I think there's something to be said for that. But we do have to realize too is that the person in front of us is the person we have to consider. We have someone that's got a very arthritic knee, has a lot of trouble, a lot of pain. Every time they squat below a certain point, they have swelling, or it sets them back. Maybe that's not worth it for that person to force that movement pattern. If we have an athlete that has goals of being an offensive lineman or needs to have that really deep squat to perform maximally, maybe we want to, it's a risk benefit. We have to say, let's go ahead and allow that athlete to do that. And what we want to do is gradually increase the load and also the range of motion that we're asking that person to work in. And you'll see us here is that we'll basically, we'll work on people on body weight squat, full body weight squat, and then we'll do mini squats with, let's say, 10, 20 pounds as people get used to it. And slowly we're trying to develop their resilience. When we run into trouble, and when a lot of people that come to us is they're all of a sudden increasing the load, increasing their distance as a runner. It's really that we're not doing it systematically, and that's where we run into our trouble. So when we're talking about the squat challenge here, is that we want everyone to kind of modify it And gradually, if you've never done squats, slowly work into maybe partial squats or unweighted squats. If you're someone that's been doing squats for a while, we can get a little fancier. We can do Bulgarian squats. We can do really deeper squats. So there's ways to modify. And when we talk in the clinic, as you'll hear, modify, modify, modify. Most exercises aren't bad, but they should be modified for that person that's in front of you. I think that's the most important thing. So I hope this helps you out a little bit and you gain a little knowledge today about an old thought that we used to think was true that's really changed a bit. And it's not always it should be a blanket statement for everyone doing squats. Have a great day.